Good afternoon. I'm Jim Robertson, the professor and chairman of neurosurgery at the University of Tennessee in Memphis and a long-standing member of the Sims Murphy Clinic. I've been asked by the AANS Board of Directors, of which I'm a member, to interview our two former presidents of the AANS, formerly the Cushing Society, that have been here in Memphis and still are part of our Memphis scene. The first one that we have the great pleasure of interviewing today is Dr. Richard DeSaussure, who is the immediate past chairman of the Sims Murphy Clinic and long very active for the good of neurosurgery in the neurosurgical organizations. After starting with the Congress almost at its inception, he rose to be president of the Congress of Neurological Surgeons and subsequently joined the AANS along the way and moved into that board of directors to become the president of the AANS in 1975 and 1976. Almost at the same time, he was very instrumental in the American Board of Neurological Surgery, serving as secretary of that organization for a number of years and having a meaningful input under the leadership of Guy Odom and others to ensure the integrity and high quality of the American Board. So it's indeed a pleasure that we introduce Dr. DeSaussure to you. He now is an Associate Dean of Graduate Medical Education in the medical school here in Memphis, chairman of the Graduate Medical Education Committee at the Baptist Memorial Hospital, which is the major teaching hospital of our training program here in Memphis, and in general an advisor and consultant to those who ask his very wise comments and advice. Dr. DeSaussure, I would like to introduce you at this time and perhaps ask you from the perspective of being the first president of the Congress, who also became the first president of the American Association, to perhaps make some general comments about the activities of neurosurgery that occupied your mind during that 1975-76 era, and perhaps make some other comments directed towards a younger neurosurgeon.
Well, thank you very much, Jim. I appreciate your introduction, and thank you very much for that. At that time, back in those days, there was a lot of talk about recertification and how neurosurgeons were going to go about recertifying neurosurgeons in different fields. I felt that this was something that was important, but like everyone else, I didn't know how a recertification could really be accomplished. So I thought perhaps if we had continuing education, that might be a good thing, and have some sort of organization that would in some way test individuals. I did get permission from the American Board of Neurological Surgery to give that in-training examination, which is given to all residents with some modification to the members of the American Association of Neurological Surgeons and others that wanted to take it. And we did actually have an examination at that time, which really went over fairly well. There were some people that had some reservation about the examination, but and they were afraid that in some way we were going to check their grades and say you can't do this or that. Of course, we had no intention of doing that. We just wanted to find out what the weaknesses were and try to promote future courses that might be given by both the Congress and the AANS to pick up what we thought might be weaknesses and try to develop them some. I also felt, since I still had friends in the Congress of Neurological Surgery, that perhaps it'd be wise to try to arrange for a meeting between the two organizations, and I did make arrangements for the two executive boards, that of the Congress and the AANS, to meet together with the idea that perhaps that they wouldn't amalgamate the two societies, but at least they could complement each other and try to help each other with their programs so that there wouldn't be too much overlapping, and perhaps some good would come out of that.
Well, I think a great deal of good has come out of both of those endeavors. As I understand it, from that beginning written examination, that's where the examination came, the so-called Part 1 of the boards that now the young residents take. And as you know, the amalgamation in terms of the Board of Directors meeting of the two societies has become tradition now. as we were speaking about a few minutes ago, concomitantly, there have been a host of sections, and the whole section growth has been phenomenal. I mean, there's a combined section of trauma, there's a combined section of tumors. In fact, I think every section is a co-section with the Congress, with the exception of pediatrics, which, as I understand, was the first section authorized by perhaps your board at the time you were president.
Well, I must admit I've forgotten which was the first one. I know that there was a number of people that felt that somehow we weren't doing the right thing. Frank Mayfield had asked that the Cushing Society, now called the American Association of Neurological Surgeons, be the spokesman. And there were some that felt that if we tried to get these two boards together, some way that would be diluted and they wouldn't be the spokesman. But I don't think that's happened. I think that the American Association is still considered the spokesman for neurosurgery, and I think that's the way it should be.
I think it is, and the Congress Board of Directors has supported that and made it a stronger voice, in my opinion. At the present time, the AANS board, you know, has changed its representation from your day when the Academy had such and such a representative in the Senior Society and other membership societies, and we now have quadrant representatives from the movement that began in about 1975 in socioeconomics. This very meaningful endeavor has organized the societies of the states in neurological surgery, and these in turn have formed various quadrants in the country to have input and actual membership locked in on the board of directors. I know this began when you were president. Would you give us your perspective about this impact on what was formerly considered a purely scientific organization?
Well, at the time there was a reservation about that too, and this did start partly at the time that I was president, and we met in California. The California delegation, so to speak, felt that they were not truly represented on the board of directors, and that's one of the things that I think I did that I feel that I did help with, and that was put Cone Peavey-House and get him started in this hierarchy. And after that, they did start having the quadrants. But I think that was the beginning. I must admit that I had a lot of reservations about that at the very beginning because I thought that they were more interested in the socioeconomics of medicine rather than furthering neurosurgery as such. But I'm glad to say that I was wrong about that, and I think that has been a very good thing. It was kind of traumatic at that time. There were a lot of well, I'm not sure animosities is the word, but there were a lot of reservations about people. Fortunately, many years before, when Dr. Murphy was trying to reorganize the Cushing Society so that it would now have the name of the American Association of Neurological Surgeons, he appointed me parliamentarian, and as a result of that, I had to read Robert's Rules of Order, and I think that this was very helpful at the time we were having our meeting in San Francisco.
Well, I've certainly enjoyed this sort of secondary talent of yours in terms of being parliamentarian. That it was instrumental in San Francisco and on a number of other occasions to get, or at least to quieten the emotions of the scene and keep it in an orderly presentation so a decision could be made. From the perspective of a long-standing chairman of the Sims-Murphy Clinic and clinical professor of neurological surgery here in the medical school and now in the dean's role, what advice would you give some of our younger neurosurgeons in terms of should they join the American Association, how should they relate with their organizations, and how should they aspire to leadership, etc.? What advice would you give them?
Well, I think that's very important. When the Congress got started many years ago, their idea was that everyone was going to have a job, everyone was going to be on a committee, everyone was going to take an active part. And I think that's been a very good thing. Of course, it's impossible for everybody to take part always, but I think they should certainly make an effort to be a part of organized medicine. I think neurosurgeons have in the past and should in the future try to stick together, and the best way to do that is to be a part of the various organizations. I think the Congress is a good place for them to get started in, and as they become a little older, their interest should shift to the American Association of Neurological Surgeons and be on the committees or try to work up into that organization. I think that's a very good method of getting started for two reasons. One, I think that you meet your fellow neurosurgeon and learn of the problems that they're having in other parts of the country or other parts of the state even. It also gives you some insight into how various organizations, local organizations, should be run. And I believe that the American Association of Neurological Surgeons is an excellent ground for having your peers tell you what mistakes you may be making in your practice or in your surgery. And I think it's a very good learning experience.
I think those are very worthwhile remarks from a senior individual. As you were aspiring in those days to leadership, and from the perspective that you now have, who were your real role models in terms of leadership in neurosurgery as you look back on it?
Well, I guess that Henry Schwartz and Guy Odom are the people that are outstanding, and also Don Matson, who of course had a very tragic death. But Don, I thought, was a good friend of mine, and I had a great deal of admiration for him. And of course, I don't think you can surpass Guy Odom and Don Matson. Lyle French was another, I think, outstanding individual. And I was very fortunate to be associated with them on the Board of Neurosurgery, as well as on the Executive Committee of the American Association of Neurological Surgeons. Earl Walker was there, and there were a number of people, but somehow I felt closer to and admired people like Guy Odom, Frank Mayfield, and Henry Schwartz.
Well, your choice of individuals has always been superb. The present apparently major crisis in practice of medicine here, according to what you read in the paper, is malpractice. Then the second thing is the changing patterns of neurosurgical practice in terms of physician-provider organizations and HMOs and that sort of thing. If you look at this from your perspective, do you feel that the younger physician should stand for the fee-for-service, or should he join in to these capitation agreements or join these various provider organizations or not?
Before I answer that, I've neglected to mention that, of course, Dr. Sims and Dr. Murphy were very influential in my career. I was just so close to them that I didn't think of them a moment before, having been associated with them for a long period of time. But to get back to your other question, I'm afraid that medicine is changing, and I'm not sure it's for the better. It used to be that all the hospitals in town, that you could go to them freely and talk to the people on the other staffs and find out what was going on. As a result of the way medicine's changing, these have all become very competitive, and I think it's unfortunate. My feeling is that you ought to join these organizations as long as there's not a big fee attached to them. If some of the organizations want $3,000 or $4,000 to join, I believe you can get along just as well without them. I think that many of the organizations are run by hospitals to a large extent, and most of these, there's no fee attached. There's no reason that you can't join those organizations and have your private practice too, and I think that's the way it ought to be as long as you can. The malpractice crisis, of course, I don't know what we can do about that. There are a lot of legislation being introduced, but I'm not sure that there's anything much that we can do.
Well, I know that you've, here in Tennessee, you've been very active in our state medical insurance company and its formation and on its board. You've been very active in our local relationship with the federal government. The PSRO, in fact, either headed the state or headed the western part of the state. You've seen all of this develop better than any other neurosurgeon, I think, in our area. And you basically feel you ought to sort of walk the middle road and not just go off and carry the flag in one direction or the other.
Well, that's correct. For the PRO, which used to be the PSRO, I felt that physicians ought to be a part of that. There are certain things that the government's going to insist on And I've always tried to act as an intermediary between what the government wanted and the physicians and try to protect the physicians as much as I could. And I believe that that's what individuals should do. Not only neurosurgeons, but all should try to take an active part in the PRO. That is, after all, the law. And I think that if there is a good and strong board, that they can protect individuals as much as they can. There are some individuals, of course, that are not going to abide by it, and they are, I'm afraid, going to get into trouble. But I believe that this is something that doctors should be interested in.
Let's change the subject just a little bit, simply because for years and years and years you certainly ran this training program in neurological surgery, because Dr. Murphy had a way of delegating certain aspects of the real work of an operation in a beautiful manner. Looking back over your former trainees and your present trainees in the program, do you see any change in the type individual they are? Do you see any change in the physician as we knew, for example, you know, we always used to take a resident after you got out of the draft, and now we interview them in the third year of medical school. What's your perspective of say, residents over the last 25 years? Are they about the same inquiring mind, or the same maturity, or is there a difference?
Well, I think that the ones that came on after they'd served time in the service were a little more dedicated. They seemed to know what their goal in life was, and I was quite impressed with the ones that we had that came in after the service. I must say that the group now seems to be quite dedicated. They seem to be a lot smarter than I ever was, and I think that the caliber of people going into neurosurgery is of much higher caliber. Their intelligence, their devotion seems much more. Of course, I think they've got a lot more to learn now than it used to be, and I think that they're certainly a fine bunch. I think we can be proud of the neurosurgeons.
Well, I surely agree with that. For example, as you well know, I objected to this matching plan, and you were always rather neutral about it. But there's no doubt that now we've had the matching plan, we're able to have a perspective of the applicant in neurological surgery like we never had before, and we really are being exposed to a bright bunch of young people.
I think that's correct. My only problem with the matching plan as it exists now is it seems to me it's so expensive for these individuals to go around to different places. Some of them, I think, who may be quite talented, may be unable to move around to see some of the programs that might fit their particular needs better. And I don't know the solution to that, but I have been concerned about the expense involved with these people that go around to a number of programs, and it's expensive to move around to those programs.
I would agree. I've been concerned about that because I would say the average applicant we see here in Memphis goes to 8, maybe 10 programs, and that is a major problem. Let's see if we can bring your advice to bear on the present board of directors of the AANS. As you know, Bob Ogerman is the president, and we'll have his meeting in Dallas in the spring. Some of the problems that we're facing now are certain socioeconomic problems, such as malpractice and relationships with the Washington Committee. We're facing certain budgetary problems in terms of new tax laws. We're facing interrelationship problems in terms of goals of the AANS, making certain that they more or less fit with goals of the Congress. What would be your advice in terms in the present board, in terms of governmental relations first, and relationships with third-party carriers other than government as an organizational viewpoint?
Well, that's a difficult problem. Perhaps I'm a little different than some. I've always felt that neurosurgeons by themselves probably couldn't influence legislators very much. I think it's if you have somebody that has a very close contact with a congressman or senator, I think that should be used. But I've never felt that neurosurgeons, by testifying before Congress, are really going to change anybody's attitude very much. And I know that I'm probably in a minority in that. And I feel that they ought to join together with some organization that they feel does carry more weight. I'm not sure that the AMA has the same goals that the neurosurgeons, and I believe that perhaps the American College of Surgeons has the goals more closely related to what surgeons, neurosurgeons would want. And I feel that we're just such a small voice, I'm not sure we can accomplish very much.
Well, I have shared some of those same thoughts. Nevertheless, although I think we represent like 0.8% of the American physician, we certainly make a lot more noise than the 0.8% of the total American physician force.
But I do think that it is worthwhile for the socioeconomic committees to have some sort of, not set fees, but make some recommendations to people about how they should interface with these various organizations, these PPOs and HMOs that are coming up. I think that does serve a very useful purpose for them. Obviously, we can't set the fees for them, but I think that you can kind of give them some guidelines how to negotiate with them and what you can and cannot do. And I think it's important that they know that if groups get together, that they may get in trouble with the FTC and the ways that they might be able to get the same information without being faced by the FTC.
Well, I know this is a real problem, and there's an effort being made right now to sort of look at a new fee survey scale, and do it in such an unofficial way as to not raise the ire of the FTC, but this is strictly exploratory at the present time. In wrapping up the interview, I think we'd be remiss if we didn't speak to the fact that both of us have been long-standing members of the Sims-Murphy Clinic, you a former chairman, and that we've had this, what I consider a rather unique relationship with this, our wonderful hospital, the Baptist Hospital. And I wonder if you'd care to make some closing remarks about Sims-Murphy Clinic and its relationship with the Baptist Hospital, and in particular Frank Groner and presently Joe Powell.
They've certainly been very nice to us. We've tried to work with them, but on the other hand, I think that they've given us a lot of things. When we've asked for instruments, operating rooms, or various equipment, camera equipment, or whatever in those operating rooms, they've been most cooperative about giving that to us. They've tried to work with the nursing staff, and I think we've had a very good relationship with the Sims-Murphy Clinic, with the Baptist Memorial Hospital. In addition, we're fortunate to be right across the street from the University of Tennessee, and I think all three, the University of Tennessee, the Baptist Hospital, and Sims-Murphy, have worked very well together. And I really think that's had a lot to do with furthering neurosurgery in Memphis. I think that one of the reasons that the Sims-Murphy Clinic has done as well as it has is because of the support it's had from the University of Tennessee as well as from the Baptist Memorial Hospital. Perhaps they've gotten some out of it too, but I think we've gained a lot.
Oh, I certainly agree, Dick, and I think that you were one of the ones to see this way ahead of the others and have been a real moving force in making the Baptist and the neurosurgical training program and the university have more of a interlocking single-purpose relationship. I want to thank you for this interview on the behalf of the American Association, and wish you well, and you are well, thank goodness. And we all look forward to seeing you at the spring meeting. Would you like to make some closing remarks?
No, I would. I don't know whether you want to keep this part in there or not, but I really think that I'm very appreciative of the help my wife has given me all through these years. She's been a big support to me. She's taken part in the organizations, and somebody pointed out that if you see a turtle up on a fence, you know he didn't get there by himself.
Thank you very much. I think this concludes our interview, and Dr. DeSaussure, the Virginia gentleman, has again demonstrated his ability to field questions with warmth and honesty and real concern. Thank you very much.